You're at the vet, choosing between Simparica Trio and Nexgard Plus. Which one is better for your dog? The answer might be influenced less by medicine and more by your vet clinic's business partnerships. Beyond that, tiny formula differences can have a massive impact on your dog's specific health needs. The truth is, there is no single best choice. The proper recommendation is a personalized medical decision. We'll break down the key differences vets consider so you can have the most informed conversation. First, both are top-tier all-in-one monthly chewables. This convenience simplifies protection for owners. Because they are oral chews, their effectiveness isn't washed away by swimming or bathing, unlike many topical treatments. Against the deadliest parasite, heartworm, their performance is nearly identical. A 2024 study showed both have over 99.5% efficacy. Both also provide strong protection against a wide array of ticks, including the black-legged tick, meaning both prevent Lyme disease. You cannot buy either of these over the counter for a very good reason. They are prescription-only medications. This requires a vet visit and a negative heartworm test before starting. So if they are so similar, where do the differences matter? It starts with the active ingredients. Both use a powerful isoxazoline for fleas and ticks, but the specific drug is different. Simparica Trio uses seroloner, while Nexgard Plus uses afoxolaner. This difference affects performance like the speed of flea kill. Simparica Trio starts working in 4 hours, and both are fast enough to kill adult fleas before they can lay eggs, stopping infestations. These technical details create specific, real-world scenarios where one product has a clear advantage. Let's look at the dogs themselves. Scenario 1. You have a very small puppy. Simparica Trio is approved for dogs weighing as little as 2.8 pounds. Nexgard Plus requires a minimum weight of 4 pounds. For tiny breeds, that 1.2 pound difference means protection can start weeks earlier. Scenario 2. Your veterinarian is concerned about specific intestinal parasites. Nexgard Plus has a broader label for hookworms. It covers 3 species to Simparica Trio's 2. This is significant in regions where the third species is a known risk. But Simparica Trio has its own unique parasite claim. It is the only one of the 2 labeled to prevent tapeworm infections. But how? The choice isn't just about killing parasites. It's also about your dog's specific health profile and even their personality. Consider picky eaters. In studies, dogs that showed a preference tended to prefer the beef-flavored Nexgard Plus chew. Think about breeding dogs. The safe use of Simparica Trio has not been evaluated in breeding, pregnant, or lactating dogs. And for dogs with the MDR1 gene mutation, like some herding breeds, both are shown to be safe at labeled doses. But vet review is still advised. So you have size, parasite risk, palatability, and safety profiles to weigh. How does a vet possibly make the right call? Let's close that tapeworm loop. Simparica Trio prevents tapeworms indirectly. By killing fleas so effectively, it stops tapeworm transmission. Remember the clinic preference point? This is why. A vet in a high hookworm area might stock Nexgard Plus. One in a heavy flea zone may prefer Simparica. This is the very reason these drugs require a prescription and a prior heartworm test. It's a safety protocol, not just a rule. It ensures the vet can weigh these complex factors against your dog's specific health before writing a prescription. Choosing between them isn't like picking a brand of dog food. It is a personalized medical decision based on a risk assessment. So, what are the key takeaways for your next vet visit? Ask about Simparica Trio if you have a dog under 4 pounds. You should also ask about it if tapeworms transmitted by fleas are a primary concern in your area. Ask about Nexgard Plus if your dog is a picky eater, or if your vet identifies a higher local risk for that third species of hookworm. Ultimately, there is no universal winner here. The only winner is the dog who gets the right medication for their individual needs. Your job isn't to decide alone. It's to partner with your veterinarian, armed with this information, to make the best possible choice together.